So my name is Jackie Wendorf, and I'm the palliative care social worker at Lee Health Palliative Care Outpatient Clinic. So this social work position is specifically working with people with serious illness. We take care of primarily cancer patients, and we take care of them from the beginning of their diagnosis and throughout their cancer journey. And the social worker will provide the psychosocial counseling to deal with issues like depression, anxiety, body image issues, things like that a lot of times will go along with a cancer diagnosis. We see both male, female, old, young, a multitude. And I guess another important thing to mention is that my services are also provided to family members, because when somebody's hit with a serious diagnosis, it affects everybody in their life. So it could be grandchildren, children, parents, aunts, uncles, anybody. Yeah, so I provide the counseling services related to the illness, like the adjustment disorder and anxiety and depression. And for something that is a little more in depth or might need longer term counseling, we make referrals all the time. What I do in my work is there's like 4 focuses that we work on to try to build strength and resilience to get through a difficult time. And we lean on a lot of the tools that they usually already have, but may need to recognize and learn to use in more. And that would be their family supports, their friend supports, their faith, recognizing some of their strengths that they've had that have brought them through previous struggles in their life, and using them to get through things now. Financial struggles are really big for someone with cancer. A lot of times patients are down in income or the only income in the house. When you're going through treatments, it can take a lot out of you, so you can't work. Even with disability, it's not you're not able to always pay the bills. So yeah, there are lots of grants available that are local or even international. It's just kind of researching what's out there and seeing what people have applied for, and making sure that they have knowledge of those the grants and the resources that are out there, and helping them to apply to. There is another big part of what we do in palliative care is talk about advanced care planning and helping patients to make plans for their future as their disease progresses, or as just in ways to identify what they would want should their disease progress. We help them with advanced directives, doing a living will, and identifying a healthcare surrogate, and then even making sure we know what kind of quality of life things are important to them, so that we can focus on that quality of life aspect throughout their journey. We do also take care of a lot of cancer survivors, because even that is not always an easy process. There are a lot of symptoms, physical symptoms, that are long-term following treatments. And there's also the emotional aspects, where you are still going to be monitored even as a survivor, so that anxiety, or scanxiety that they call it, for when you're getting scans, if it's every 6 months or every year, just the worry that comes back with that can be a lot to deal with. And so we talk with patients about that, and how to manage that and keep that low. Because if you or I were to get a headache or a new pain, it means something completely different than somebody who has a history of cancer in their past. When they get a pain, they think the worst, So yeah, it takes. We do a lot of work with survivors here too.
Okay. Fantastic. Well,